Welcome to Kenton's videos. Enjoy the video.
You should not attempt surgical fixes at home. Start by assessing what you actually see. First, document when the extra fold appeared and any changes. Next, list medications, allergies, and prior eye procedures so your clinician has a clear picture. Then call a board-certified oculoplastic surgeon or dermatologist to arrange an evaluation. Once booked, prepare 3 to 5 questions about risks, recovery time, and alternatives, and make sure to bring photos that show the eyelid at different angles. In the clinic, the specialist evaluates eyelid anatomy and explains possible causes, skin redundancy, scar tissue, or crease anomalies, and why each matters. You will review non-invasive alternatives versus surgical correction, and the provider should outline techniques, anesthesia options, and realistic outcomes. Ask for recovery timelines and photos of similar cases. Once you understand the trade-offs, make a shared decision about next steps. If surgery is chosen, preoperative instructions and consent will be provided. After any professional procedure, recovery care is crucial. Follow prescribed medications, keep the area clean, use cold compresses as advised, and sleep with your head elevated to reduce swelling. Attend all follow-up appointments so the clinician can monitor healing and remove sutures if needed. If you notice worsening pain, vision changes, sudden bleeding, fever, or signs of infection, contact your surgeon or seek emergency care right away. Make sure you have an emergency contact and clear post-op instructions before leaving the clinic.
Thanks for watching. Consider subscribing if we helped you.